Florida Health Plan Partners wants to inform the community. Ginette Velez, founder of Florida Health Plan Partners, was on with Mary from your hometown on 1520 WBZW to inform the community about health care coverage options now that annual enrollment is here. Contact FHPP at 407-430-5322 or FloridaHealthPlanPartners.com to take charge of your health care.
So I'm sitting here and this is something else that's really nice because we have a wonderful two guests in our studio. Ginette Velez.
Hello.
Welcome. Hello.
Thank you.
And Zwain.
Yes.
You only get one name.
I only get one name. I'm like Cher.
You got to pay more if you're going to do
That's right.
two names. And now, Ginette.
Zwain is a good friend of the house, too.
Yeah.
Zwain is a good friend of the house. Well, he used to be on air here, right?
Yeah,
you did production here?
Yeah, for a couple of years.
The voice you hear in the background is Gabe Cassiano.
Oh, thank you.
And,
thank you for introducing me. Yeah, I'm here. I'm still here.
Even though Gabe, for the last 3.5 months, we were in the same room, I could see him right across the table. Now he's like 2 rooms away.
Now
and
you forget about me.
It's no fun. I like it when we were in the same room together. But anyway, Ginette and Zwain are here together, and we're here because this is important. This is an important thing. Ginette is here. She's owner and principal agent of Florida Health Plan Partners because it's, guess what, open enrollment time for Medicare. So we want to talk about that because the season is coming up. We're in October, and it's real easy to lose track of the fact that we got work to do.
Right.
Yeah. So tell us about that and what some of the things we need to know.
Okay, so it's open enrollment, or we call it the annual election period is the formal name, or AEP, which starts October 15th through December 7th. It's when really everyone in the whole United States can enroll in a Medicare Advantage plan. What my team and I do is we help people explore their options, and we represent several different plans.
So let's say you've got a person who's 65 years old. What do they need to be looking for primarily?
Well, a person turning 65 has the most options, I should say, because as far as their enrollment period is concerned, they have what's known as an open enrollment or initial election period for a person turning 65. So a person turning 65 can either choose to go with a Medicare supplement, which is a private insurance that they have to pay a monthly fee for. They have to pay for their Part D, which is their prescription drug coverage. They'll have to pay for their Part B premium and the premium on the insurance. The nice thing about that is that they are in their initial election period for them, and they can choose a plan up 6 months prior to turning 65 without any pre-existing conditions. So they're automatically approved. And that's a nice feature, but if you have the money to pay for something like that, that's an option.
So let's say someone is 64 now.
Right.
The election period is now.
Correct.
They're going to turn 65 in July.
Right.
They want to come now.
Correct. So
they don't want to wait until next and get caught in that middle period when they've got no coverage.
Right. Well, the best time to do it is for a supplement is 6 months prior. You want to elect it prior to your 65th birthday.
Okay.
Because if you wait until after that, then you're going to get underwritten. So we don't want that.
What does that mean?
The insurance companies will rate you based on your health conditions, whereas prior to turning 65, there is no underwriting.
When you sign up and you do just the way you're describing it, the best possible way, which is 6 months before you turn 65,
right.
Once someone is signed up and they've selected or elected whatever they're going to, ongoing, do they get evaluated from a health standpoint? Are there periodic decisions made about their health ongoing or going forward?
No. Basically, well, I didn't get to finish the second option. That's okay, but I'll answer the question afterward. But the
Just
second
ignore
option,
me.
no, that's okay. No, it's complicated. There's a lot of information. But quickly, if someone's turning 65 and they choose not to go on a Medicare supplement, they can choose a Medicare Advantage plan, which is a lot less money for them with a zero premium. You can have an HMO or PPO. And the only thing that you cannot have health-wise is end-stage renal disease.
Oh, okay.
So you can qualify for any of the Medicare Advantage plans as long as you don't have end-stage renal disease, because Medicare has special programs for people that have kidney dialysis, which is what that is.
So would you help them get that special program, or do they have to go a different route?
We offer all the plans. We offer Medicare supplements. We offer Medicare Advantage plans. And the open enrollment, the initial election period for Medicare Advantage plans are 3 months prior to their turning 65. So there's 2 different election periods when you're first turning 65. That's why it's important to call us so that we can educate them about their options and what's best for them.
Now, that's the first time we've mentioned the call you part. Why don't we do that now? Because we'll get deep into our conversation here, and then we won't have given it a phone. So how, Ginette?
Well, Zwain will make sure I get that out.
Believe me, I will.
Right. So give us a contact number.
It is 407-430-5322.
And you can also check them out at Florida Health Plan Partners on Facebook.
Let's do the phone.
430-5322. 407-430-5322.
Okay. And Zwain?
And Florida Health Plan Partners on Facebook as well.
Florida Health Plan
Partners.
Florida
Health Plan Partners, and FHPP for short.
FHPP, which is actually what you'd like them to keep in mind.
Yeah, FHPP. When you say FHPP, you think Florida Health Plan Partners.
And is that going to be .com?
FloridaHealthPlanPartners.com is the website.
Yep, good. Okay, perfect. So there'll be a lot of supporting information to what you're talking about today.
Yes.
They can find that. I retired I don't know I'm retired actually. I retired from my job. I don't know how to be retired apparently, about 7 years ago. And I went on to the Medicare, wait a minute now. I went Blue Cross Blue Shield, Advantage.
Okay.
That's what that's good for. You know, we talked about renal, but if there's someone who's really healthy, so I pay like $41 a month. I have a very low monthly, and then I pay per visit because I don't go that often.
Right.
I don't, I say humbly, prayerfully.
Thank God.
I don't have, thank God. I don't have conditions.
Right.
So there's that available, right?
Yes, actually, it's a Medicare Advantage plan. It sounds like what you have right now. You do have the option to review your plan every year on a Medicare Advantage.
Yes.
Typically, a person that has a Medicare supplement will stay on the plan for a long time.
Right.
And they won't look. So people that really want to stay stable, they want to pay a certain amount every year, they don't want to go through the trouble of looking for a new plan every year because they do change. They change.
Yes, they do.
They change co-payments. They may have doctors that are not in the network or join the network.
We want to talk more about that because we're going to take a quick break. And here we are back on a cheery Apopka afternoon. I always say it's cheery, even though sometimes there's no sunlight in our windows. But the fact of the matter is it's autumn. It's beautiful. It's supposed to have a little bit of a smoky afternoon look, and it's going to be cooler in the morning this weekend, right?
Yes.
I see across from me, Ginette Velez is nodding, and with her is Zwain.
Yes.
Ginette is the owner and principal agent of Florida Health Plan Partners, FHPP. She's here because this is important. Ginette is discussing, it's now Medicare open enrollment time. And so tell us more about this. We started talking about choices. And what do people need to know?
Well, if you're interested in a Medicare Advantage plan, there are several different choices, such as HMO plans. There's PPO plans.
Yeah, I have the PPO.
There's plans with referrals, which are typically the HMOs. Actually, this year, there are a couple of plans that have come out that are HMOs that don't have referrals, so that's something new.
Yeah. I have the Blue Cross Blue Shield Advantage program. Is that the signature program for Medicare, or how does that work?
Not the signature program for Medicare, so it just depends on your income sometimes, which plan you're on, because you can qualify for assistance through the state, and our agency handles those applications as well. So if you qualify, if you have low income and you qualify for assistance from the federal government, we will fill out the application for you, get the assistance, and place you on the correct plan. There's several different plans.
And that's so good. I just have to stop you there for a second, because one thing that people need, and I know this from my own experience, people need a person to guide them through this.
Absolutely.
People are afraid, and people will hesitate. They will stall. They'll procrastinate because they don't want to get into all the paperwork.
Exactly.
That's typically what people think. But it's good to know, Ginette, that you're a person who's there, who can lead them through the process.
Right. We're at seminars. We're at Publix.
Yeah, you're out there. Yeah.
We're at Walgreens. We're marketing all different types of plans. We'll go to your home. We'll do the assessment
That's
for free.
Good to know.
Yeah.
I want to give your number again. It's 407-430-5322.
Correct.
Or FloridaHealthPlanPartners.com. FloridaHealthPlanPartners.com website. They could tickle around there and find out a lot of things. How do you know it all?
I've done Medicare for over 11 years, and I started out as an agent for 4 years, and then I became a regional manager for one of the major health plans for 7 years.
Wow, that counts.
And then I worked as a vice president of sales and marketing for a large provider of 16 offices.
But you're only 26. How did that?
Thank you.
You started young.
Yeah, it just became my niche. I loved working. I found my niche. I was doing real estate closings for many years, and when the market crashed, I decided to possibly go into an industry where the market wouldn't affect my job, and I found insurance.
And plus, clearly, based on the industries you've been in and the work that you've done, you have a good analytical, detailed mind for this.
Yes.
See, I don't.
Right. Yes, you do need that. Absolutely.
I'm a writer. I'm a talker, but I need somebody to help me with, is that like, what's the percent, and what about clause 5? I don't know what clause 5 is. All that kind of stuff.
And you do need someone who is a professional, because, for example, this year Medicare supplements have changed. Last year, you could get Plan F with no deductible. Actually, someone called me the other day and asked me, am I going to lose my Plan F? No, you're not going to lose your Plan F, but starting in 2020, if you're turning 65, F is no longer available, only Plan G.
Is F the prescription?
F is the medical portion of the supplement. You have a Medicare Advantage plan, which is different from a Medicare supplement. But a lot of people higher income typically will have a Medicare supplement.
Oh, I see, yeah.
Yeah.
I don't even know the language of this.
I know.
I'm a dope. See, I'm your typical
customer.
Client.
Yes.
Exactly. Mm-hmm. Because I don't get it all. And fortunately, I was set up early and well 7 years ago, and all I do is go back and I just say, what's changing? And that what you mentioned a minute ago, and Wayne, I want you to chime in too.
Sure.
But you mentioned a minute ago, and we could talk more about this when we come back in the next segment, but that whole thing about making sure we're your doctors.
Oh yeah, that's a big deal.
That counts for me every year. Wayne?
So one of the things that I have noticed while working with Ginette is the difference in the way that, in my opinion, that she talks to people, potential clients and potential Medicare members, but I see it as very different than other people in the same industry approach it. So after she's done, talking to the people, and after they're squared away, they have a question or anything like that, she is very, I could show you the text messages. She is up at all hours. I ask her if she sleeps. I ask her if she sleeps, but the reality is that is the major difference between the different insurance companies, the different insurance providers, is the level of attention that you get. You
have
don't
good
get
eye
that.
contact.
Yeah.
You have good eye contact.
See?
Well, I know it sounds funny, but we don't want to sit down with a person who never gets their nose out of the papers.
Absolutely.
Because we're just a piece of paperwork.
Yes.
Yeah.
And there's a lot of agents. This market is extremely competitive for insurance agents, right?
Yeah.
But one of the things that we bring to the table is the customer service that we provide. So if you have a question about your health plan, we want you to call us first. And if we don't know the answer, we'll do a 3-way call with you to the health plan to make
good.
sure that your
Get everybody on the
problem
line.
is resolved.
Yeah.
And that way I feel comfortable. Okay, you called me. I want to get you on the phone because they won't speak to me. The insurance company will not speak to me. I have to have your permission to speak.
Right.
But if I get on the phone with you, you give me permission to ask the right questions to find out, because we know what questions need to be asked.
Sure.
We know sometimes the insurance companies will give you an answer that's unacceptable, for me at least, and then I correct them and say, no, you have to do this. So it's great for someone to be there with you when you need the phone calls.
We need some hand-holding. This is serious stuff, and it doesn't,
it's your health care.
It has long lasting results. Quick comment, Wayne. We're going to break.
Well, what I was just going to say is exactly that. You asked the question of how does she know so much information? Yeah. Well, it's over a decade of doing that every time. Calling the insurance company, asking the question, and when they get the response, she keeps it in her head. So that way, the next person.
Absolutely.
We have more questions coming up, more that people need to know when we return on 1520 WBZW, your hometown live. Kind of funky, right, Gabe?
Yeah.
Yeah, a little bit.
But it's not up to 4 that you get to dance.
We only get to dance around the studio after 4 o'clock in the afternoon, I know. And on Friday afternoon, it gets a little crazier. Anyway, but we're having a great time in the studio today because we're with Ginette Velez, who is owner and principal agent of Florida Health Plan Partners, FHPP. Medicare, open enrollment, your guru for this period when it's so important for you to get things right. So, and what's important about that is, I think there are lots of people who can read you the stats. But it's also important because what you're trying to really offer people is not only your years and years of good knowledge and experience, but the up close and personal, that you can really relate.
Absolutely. We enter homes every day, especially at this time period, and you'd be surprised at what you encounter in someone's home, how they live, and not just how they live, but their health conditions. Some people are very healthy and they're active, and then someone's 65, 66 isn't healthy, or they can't, or they're not even mobile. So you have to have a lot of compassion in this job. You have to have a lot of patience.
And no judgment.
Yeah.
Right?
No. Yeah, because
I don't want anybody judging me because I'd be out at the first.
Yeah, so it's you encounter a lot of different people, and you have to be able. Every person's individual health is important to them and unique to them. So what may be good for your spouse is not good for you.
That's true.
Lots of times couples say, "Well, I want what my husband has," but that's not really true. That's not really correct. And
we have different medical histories.
Absolutely. So. We like to assess the situation, ask the questions.
Ask good questions.
Absolutely. And then help them.
And excuse me, this is important. This is important for people to be honest and not be afraid of the questions.
That's true.
Because you don't want something to come up 3 months after you enroll and bite you in the ankle.
Correct.
Be truthful with, and the good thing about someone like you is being candid about your health with someone like you. You are going to try and tell. You're going to treat that information very carefully.
Absolutely, it's very important. And there's so many different plans out there, so we have to assess your needs and then say, okay, recommend that this. We're going to empower you to make your own choice.
Yeah.
But at the same time, we're going to educate you and say, okay, these are your best 3 choices. I recommend this one. You can go with this plan, or maybe you should stay where you are. And that's one thing that we do. If you're better in the situation that you're in, we're not going to change you simply just to change you.
Sure.
We, and that's one thing that I stand by. It's the integrity, because some agents don't really have the integrity. They just want to switch you just to make an extra $1.
Yeah.
And
be done with it. Yeah.
And I've gotten so many referrals from saying to someone, look, just stay where you are because this is the best place that you're in. And I get so many referrals by just doing the right thing. We do the right thing for the client.
Isn't that, and as a business owner, doesn't that count? Just do the right thing, and it will come in. I mean,
Absolutely.
tenfold. People will tell others, you need to talk to Ginette Velez.
Yes.
I mean, that's how I operate. You know, I want to know, and then if I know someone good, I want to share that, whether they ask me or not. I want to share it and say, oh, by the way, you know. So that means a lot. So you mentioned that you're busy at this particular time. You're out telling the important word that this is the open enrollment period. You said you were doing programs and little seminars, maybe. Are there things that people who are listening might want to go to?
Yes, absolutely. We're doing a couple of Medicare seminars for several different health plans in Orange County, in mostly Orange and in Seminole County. So if they want to attend a seminar, some of the seminars...
Is there one coming up that we might tell them about, or should we just refer them to the website?
Actually, they can give us a call, or they're going to be posted on our Facebook page right now. But they can give us a call. We can invite them. Some of the seminars, they'll be able to get a $10 Publix gift card.
Nice.
So that just by attending this seminar.
Can I attend the seminar?
Sure. Yeah, sure.
I can attend the seminar?
Actually,
I would love to.
You better be there.
I'll be there.
you'll be there a few times, right?
I'll be there 3 or 4 times.
I think Gabe Cassiano in the other room will be there too.
We'll get
I'll go with Jude. I'll go with Jude Swain.
Let's get some grocery shopping done.
Yeah.
Actually, we do have to give a $10 gift card to everyone that enters, because we don't know if you, Zwain, who's like 40, has Medicare.
My back is hurting a bit. I could be 65. I just aged
and he's
really
really young for his age. Well, although I'll tell you, Gabe in there, he's got an age story, which I'm not going to tell. But
Get that, Swain.
Yeah,
hear that. I want him to hear it.
What is your age story?
Tell him, Mary.
Tell him your secret.
Yeah.
How old do you think Gabe is?
Oh, I know how old Gabe is.
Like 30.
No, he's in his 40s.
He's 43.
Oh, okay.
He's 43.
He's 43.
I remember we had this conversation.
Seriously, I was so shocked. I thought he was like 26 or something.
I was told last 2 days ago, I was at a networking event, and they thought that I was 27. Which is hilarious.
Some people are some liars. Some people are liars.
Yeah, the people that told you that you look young.
Yeah, right.
Yeah, exactly, because I don't.
Nice to look younger than you actually are.
You mean people who told me I look 35, they lied to me? Is that right?
They were trying to sell me something.
Right. So, no, this is good. I want to give your phone number again. You can reach Ginette certainly after the show, and I will bring this up in days following the show to make sure that we just keep. I do that periodically with different important events, and this is certainly one of them. You can reach Ginette at 407-430-5322. You can also email, not email. Is that email, or is that the website?
If they want to. It's Ginette at FloridaHealthPlanPartners.com.
Okay, now wait a minute. Ginette at. Okay, so it's like your website, except Ginette at.
Yeah.
Yep.
Okay, I'm just going to put that down. Yeah. And Ginette, it's tricky. Mm-hmm. It's Ginette. So if you're going to say, I know how to spell Ginette, Jeanette, it's not going to work. So it's Ginette at FloridaHealthPlanPartners.com. That's email. Important for email. Or the website where you can poke around and look at all kinds of things, FloridaHealthPlanPartners.com. Yes. Because I think probably, Ginette, they would like to know where you're going to be. Is there one coming up roughly in the next 2 weeks or a week and a half or roughly? November?
Next week. Next week we'll have one.
Nice.
We're there's a couple of plugins, but we're going to the Golden Corral. We'll be at Denny's. We'll be
nice.
You'll get the invoice at the end of the show.
Hey, they'll send it to me actually.
We're at Walgreens. We're at Publix. So we're everywhere. And there's a few of us. We'll have our shirts on. And
so you have some people working with you that will help with.
Yes, we have 5 agents right now. I like to keep the team small because I want experienced agents.
Yeah. Boutique service.
Right. We want a boutique service.
Yep.
Yes.
And they're very they're very knowledgeable. The people on my team.
The one thing, if I may say, that people don't want, I think it's fair to say, is a faceless, nameless, Is so and so there? No. Yeah. Who are you looking for? I'm looking for. Well, no. Hold on. Which department? We can't handle that.
This is more
So
personalized.
that's good.
They'll call me if I'm unavailable, or I can refer them to one of my agents, and they'll get the same customer service. They're going to get the same experience.
Yeah.
Collectively, I think we have over 25 years of experience in
Nice.
Medicare. So
We want to talk more
know.
about that. We're going to take a quick break. I want to ask you more about that when we come back on 1520 WBZW, your hometown live.
Well, I wonder what it's like to be the rain.
Well, we haven't heard this song before, Gabe, have we? Are we going to dance to this in the 4 o'clock
Yeah, we
hour?
played it the other day. Not up to 4.
Not after 4. Not after 4. Okay. So
Remember the rule.
the rule. We stick to the rules. So we're back on 1520 WBZW, your hometown live, and we are with Ginette Velez. And it's important, if you're going to be contacting Ginette, to know that the spelling of her name is Ginette. It's not the typical spelling, so it's Ginette Velez, Velez. And she is owner and principal agent of Florida Health Plan Partners, FHPP, Florida Health Plan Partners.com is her website, and her email is Ginette at FloridaHealthPlanPartners.com. We've been talking about, the importance of examples of what, the service. That's what people want to know. Are you somebody they can deal with? Will you make things clear to them? Do you have an example of something where you really helped someone adjust maybe what they were thinking about getting or what you discovered?
Absolutely. I had a client recently that didn't know that they qualified for Medicaid, and they couldn't afford their co-payments. And they had to go to the hospital, and they didn't want to pay the co-payment on the current plan that they were on.
On the Medicare payment
Yes.
Plan?
So what I typically do when I meet someone or when I go on an appointment for the first time, I ask them what their income is so that I can first help them.
Right. You
and
don't want
see
to
if I
steer
can
them
help
towards a program that is completely out of line.
Absolutely.
Right.
And so many people qualify for assistance and they don't know it.
Right,
And,
right.
And some people think, oh, I don't need that. But if the government is going to offer you any kind of assistance, you may as well take an advantage.
And that would be like the Medicaid part.
Yes.
Sure.
And that helps them with all of their Part A, their Part B, and including their Part D, which is their prescription drug coverage.
Right, right.
There is another program from Social Security that is not Medicaid, but it helps them with their Part D. So it'll help them pay for their prescription drug coverage.
Okay.
If they have any penalties, they'll no longer pay the penalties. If they have a monthly premium, it'll cover the drug premium. So they thought they didn't qualify.
Right.
And I was able to show them in black and white, here's your
Nice.
income, here are your assets. You qualify, let
Sure.
me do the application.
What are some other questions that you might ask to help with good discovery? Anytime, and this is true of business, whatever kind of business, good discovery is important to the client.
Absolutely.
So where have you kind of seen that go, well?
Well, it's important, with Medicare Advantage, there's a lot of restrictions on what we can and cannot ask. So we can't ask you any medical questions.
You can't?
No.
Okay, yeah.
That's on the Medicare Advantage side. On a Medicare Supplement, it's different because it's not governed by the federal government.
Right.
However, we can go over their medications. We can go over their providers of primary care, what specialists they see, so that we're able to tailor, okay, this is the plan for you. You're taking a lot of medications. We need to get you on a plan that has
Right.
lower copays for you. Or you're pretty healthy, you don't take a lot of prescriptions. Maybe you want a refund on your Part B premium.
There you go.
Because there's plans that give back a buy down on their Part B premium, which reduces the cost for them. All of the plans are pretty much competitive. You just need someone to help you navigate through all the
Navigate, for
plans,
sure,
so that
yeah.
you can, because it's confusing. I mean, I wouldn't know what to do with. There's at least 11 plans in the market,
Wow.
and I wouldn't know what to do with that.
And what about,
I need someone to help
and
me.
also, you were talking earlier, you mentioned changes. What are some of the changes? And I think you mentioned our president, President Trump, just made some statement about Medicare.
Yeah, I believe he signed, I'm not sure, he didn't release all the details, but I believe that he made it better for Medicare. So we're all looking forward to seeing what that document is.
Great.
That's going to be wonderful for our seniors. So we're happy about that.
You know, I was surprised. I'll just say this. I was surprised last year that what I pay as I go, because I have a healthy person plan,
Right.
Blue Cross Blue Shield Advantage,
Correct.
and I pay like $41 a month, and then I pay when I go to a specialist.
Correct.
I pay $10 for my physician,
Right.
which is amazing, really. But here's what's funny: is 2 years ago I was paying $50. And they dropped it to $45. They actually, so there's a lot of talk about, health costs are skyrocketing. But somewhere in the middle of everything reduced in price.
Yes, actually, there was a sequester tax, which was the Obamacare tax that went away for a lot of the Medicare Advantage plans. And so they were able to offer better benefits. So that's why all of the health plans now are in serious competition, because they all have extra money to place back into the benefits.
Yeah.
So that's why you see a lot of reduction in the co-payments and a lot of reduction in the monthly premiums, because now they don't have to pay that tax that they
that's
had to
pretty
pay
cool.
several years ago.
Yeah.
So that makes it extremely beneficial for the Medicare beneficiary, because now they sometimes, they'll see their plan, and next year, hey, my premium went down, or hey, my co-payments went down. So
My medication is free now. I have 2 low dose medications, and they went from I don't know, $20, $25. I get them free.
Right.
I get them through Publix pharmacy, and they're free.
yeah, so that's
It's just amazing to me.
That's the benefit of that, and on top of it, some of the brand drugs go generic after a while.
Right.
So it's important to, look at that's what we do. We'll say, okay, you're taking Plavix, let's say, and that Plavix can be expensive, but there's a generic now for Plavix.
Right.
So we can't tell you, because we're agents, we're not doctors, but we can say to you, these will cost you $0. Go to your doctor, ask him if you can take these. He might say yes or no, or he might say, maybe you've tried it before and it doesn't work for you. But that's a conversation to have with your primary care doctor. And once you kind of decide if you can take it, the people take brand name drugs all the time because they don't know.
Well, I was first prescribed Lipitor.
Right.
But now I've been taking a torvastatin.
Exactly.
It's a generic.
Exactly.
Before, I want to make sure we don't run out of time. Did you? I know, Zwain, you went and got a schedule.
I did. I'm prepared, like a Boy Scout.
Like a Boy Scout. Yeah, it's good.
Right.
So, because it would be good if they knew that there's an upcoming program or something that they could.
Actually, they can meet live.
That would be nice.
Yeah.
Yes.
She's doing a remote.
There is a face behind the voice.
A very nice face band, a very nice and friendly voice.
Thank you. Okay, so we will be at the Golden Corral at 897 Westtown Parkway in Altamont Springs.
10 meat buffet.
Is it?
I don't know.
Well, we
Maybe they used to have,
can't
true.
feed you.
Gotta go there.
At
Now,
the
when is
seminars,
that?
we can't feed you, but we'll provide some snacks.
Yeah,
And-
people can go there and get a bite to eat.
Absolutely.
And learn something. People
Absolutely.
are happy to do that.
And I want you to check how the food choices change after they talk to you.
Right.
Maybe I don't need this medication.
Right. So what's the date on that one?
That's the 17th at 10 a.m.
October 17, 10 a.m.
Yes.
Now, which Golden Corral is that?
It's the one in Altamont Springs
Oh, yeah.
at 897 Westtown Parkway.
Yeah.
Right down the street. Right around the corner.
It's
Yes.
right near, I have a frog in my throat. I keep waiting for it to turn into a prince. That hasn't happened. But that's right near the Costco, sort of, right?
Yep.
Over
Yeah,
by Costco.
not
Yeah.
far.
Right there by the Costco, there's I think a PetSmart there, right across the street.
Yeah. CVS
Subway.
is right up there. Yeah.
We're actually going to be at a Popka a couple of days in November, but the next one is going to be at Denny's in Castleberry, if you missed that one.
Yeah.
On 198 Cimarron Boulevard in Castleberry.
Yeah,
at 10 a.m.
436. And when is
Yep.
that?
The 23rd of October.
October 23rd at
Denny's in Castleberry.
Time
At 10 a.m.
Oh,
sorry.
also 10.
Yeah, so you could go to, it'll be at Denny's at 10 a.m. That's the 436 and 1792 right there near, there's a 7-Eleven there and a whole bunch of other stuff. But yeah, the Denny's there in Castleberry.
We want to thank you for coming in.
October 15th to December 7th is your annual enrollment window, but your time to meet with your agent is now. Call FHPP at 407-430-5322 to start a relationship with Florida Health Plan Partners and take charge of your health care.